What's going on, everybody? Welcome to a special additional edition of I've Got 10 here on DentalCast Productions. I'm John Stamper, your host. And as many of you know, I've been spending time each week with a lot of the coaches and consultants that are a part of the Dental Consultant Connection Network. And each one of them brings such a level of insight and expertise in their own right, which has been awesome to be able to spend time with them. And on today's episode, I'm very excited to have Dr. David Black, who practiced dentistry, I think you said, David, for close to 45 years. And now he's been working as a coach and consultant for 5, and so much in that head of his to share and help dental practice. So we're really excited to have you on the podcast today.
Well, it's so good to be here. Thank you for letting me share.
Absolutely. So before the podcast, everybody, David and I were talking. We're like, okay, what direction can we go? I mean, certainly he has, experience and expertise in a lot of these different areas, but he came up with a really good idea, which is talking about kind of those last 5 years before he retired and some of the things that he had to do and what that journey was like. And so we thought maybe it would be beneficial for him to share that with all of you and to put into that perspective. And he teaches and coaches on that a lot now. So that's where we're going to go today.
Great.
Excellent. All right, David. So yeah, if you want to maybe kind of, start with those, the first of the 3, and we'll go from there.
Okay. I was 55 years old. I had less than $100,000 in my retirement fund. And I came to the revelation that I was going to have to work forever. I wasn't going to be able to retire on what I had in my retirement fund. I had a good practice and we were living well. I was sending my kids to private school. We had a nice home, but I just wasn't saving anything. And so what happened in the revelation that I had was that I was going to have to change something. And what I was going to have to change was increasing my income and saving it. And so what I did, this revelation led me down the road to the road that I had to take to do this. And so what I needed to do first was find some coaches to help me. And I got several. I had my CPA sort of line some things up. And then I actually hired Jameson Consulting. And that was one of 5 different consultants that I'd had over the years. I had a lot of consultants because anytime I would hit a wall or a roadblock, if I didn't have any sense about anything else, I at least knew to find someone who could help me on my way to get past that. So what happened was I hired Kathy Jameson and her group. They came in, did quarterly meetings with me, ran me through the 25 systems, and we changed systems, worked smarter, and they were able to help me within 1 year to increase my production and collections, because they also taught me how to collect, and we collected probably 98% of what we did. I was a fee-for-service practice. I didn't work with the insurance companies. And so I was able to increase my production by 30% in 1 year. Our standard of living was pretty much the same. So my wife and I lived the same, only we learned how to structure our retirement to save most of that 30%. I also had another consultant who was a financial planner, was McGill, and down in Charlotte, and they built us a plan, a written plan, a legal plan that I was able to save a whole lot more money than I would on a SEP or an IRA. So the road was to find the right people to help me and to implement it. Now the hard part was actually doing it. And, actually saving the money and not spending it, and not, my old habits were to spend and then earn more, to make up for what I just bought. So the result was, the third R my result was that I increased my productivity by 30%. I got into the top 5% of the national average of practices in my production and collections. I saved the money. We could save almost $70,000 a year in our new plan. And at the end of 3 years, then I had increased the way practices are evaluated for sale are an average of the last 3 years of your practice is usually the average they use to give your appraisal. Well, I had a 30% higher appraisal, so I ran into the guys who wanted to buy my practice. It was I had built something that someone would want to buy, and I got 30% more than I would have 3 years earlier. And so then I worked for them for 4 years. I rented them my building that I had paid for, got a 10-year lease on that. I went to my stockbroker. I said, do I have enough? And then I went. Now I was 68. I wasn't a baby,
right? But
at 68, I was able to walk away from the practice and start doing other things, including consulting.
Yep.
So had the revelation that I was in trouble. I worked the road by finding the right people, and the result was I was actually able to retire. I'm 72. I still enjoy working. I still enjoy doing other things, but I don't think I would enjoy sitting there every day, every day drilling on teeth right now. There's even though that's a good job, I enjoy doing other things like this.
Sure. Well, you did that. You paid your dues. You did that for a long time, and I'm sure you helped a lot of patients. And I think first off, thanks for sharing that story. I love when people share those things. I think that as you know, David, for a lot of dentists that are just starting out, and they, all the things that are on their mind, or if people mid-career, what have you, and as they're starting to kind of think of what that's like, and then certainly to be able to hear that from you and know that it was really towards the tail end, like you said, of your career when that clicked. And that's one of the things I wanted to ask you, which is from your experience, and of course, now that you're doing this, working as a coach and consultant for practices and dentists and things like that, but what do you think it was, or what do you think it is a lot of times with dentists, why it can take a little while, whether it be to maybe find the right person for it to click to say, you know what, it's going to be beneficial for me to bring somebody in order to kind of have another set of eyes to help me. What did you learn through that process?
Well, I have another story. It's the story of the fact that I had 7 associates, one at a time.
Okay.
And all of them either left voluntarily or involuntarily. And I learned something every time. It was, I learned the structure. I learned more and more toward the end. I learned that these younger people are wired a little differently than I was.
Right.
I was one of those first graduates in the family. I was one of 4 kids. But it's getting harder, I think, for young doctors to go out and set up on their own. Right. And I think that more and more they're going to be looking for these associate jobs. And I think that us older guys are going to have to learn how to communicate better with them. And, I look at my 7 associates and say, okay, what was the common denominator in the failure of these 7 different associateships? And it was me. Either I was intransient in my standards, I maybe didn't know how to market correctly. And I think that all of us are going to have to learn how to market ourselves. I don't know of anybody that did what we're doing here today
Right.
back, 25 years ago. There probably were a few, but to get out there and to promote ourselves so that we can actually support another associate is one of those things that I think that we just have to learn more about. And you have to learn the business too. You have to learn how to make the associates be busy enough that they want to stay there. You have to treat them right. And, you have to learn your communication skills so that you can attract and keep good people.
Absolutely. It is, it's very refreshing to hear that coming from you. I often will talk to people about continuing education and progressing in today's world of dentistry to really get ahead. And you talked about all three, which is the clinical piece, certainly the business piece, but then the people.
Mm-hmm.
And I would say to guess that when you went to dental school, there was probably not a lot of business education going on. And the only people training was maybe the fact that you were, working with the patients or what have you. And I can just imagine from your perspective, as you have watched dentistry grow and all these different avenues come in of training and education for dentists, it certainly has changed a lot and for the better.
Yes, very much for the better.
Yeah.
I know my uncle was a dentist, and I was lucky enough for him to take me under his wing. When I first came to Roanoke, I'm in Roanoke, Virginia. It's a small city in Virginia. But then I think that probably by luck, I started running into different mentors. And I also started going to places like the Pankey Institute, which taught you the communication skills and, taught you things that you needed to do that. I think that's a piece that so many times dentists will learn the clinical part, but they will totally forget the people part. And I think we're all going to have to learn more and more about that, not only for taking care of your patients, but also taking care of your staff. And if you want to keep an associate, you need to learn how to talk to them and how to find out what they need and not just blow them off and say, hey, you're supposed to do this because I'm the boss.
Yeah.
Which I was obviously probably guilty of in my earlier days.
Yeah. Well, I think it says a lot about you now in your career with where you're at, to look back and the more people I talk to, there seems to be this level of appreciation for individuals like yourself or people that have gone through a lot in dentistry that are coming back out and saying, listen, this is what I did right. This is what I didn't do right. This is what I learned from. And to me, David, that education is priceless, right? I just think that we're seeing that more, versus maybe the days where, continuing education courses. I mean, everything was about, look how perfect that this is or whatever the case may be. And it's encouraging to see. And I know it takes a lot of courage, but I would imagine that the people that you're working with now in practices can really value, that authenticity. It's like, listen, you're like, hey, I've been there. This is what happened, and you can choose to learn from it or not, but it's real. So.
Thank you. Yeah. I hope it is. That's one of the reasons that I'm continuing to work. I don't have to work. I enjoy working. And that's a good thing about retirement. What I call retirement is doing what you want. And if what you want to do is working, then that's fine. But it would really be bad if you had to work because physically I can't do what I used to do. And so it's kind of nice to sort of casually go in one day a week and check hygiene patients.
Yeah.
And the consulting part is also great. I teach also at a couple places that have, we precept at a clinic, and also there's a residency program I like to go over and speak on various things there. It's all fun. I'm enjoying life. It's really good. And I'm glad to be able to get some of the stuff that I've trapped in this head of mine to be out, and maybe somebody can have some good come of it.
Well, excellent. So what we're going to do, as we've done with all these, everybody on this podcast series, is we're going to go over and record our audio podcast. And we're going to get a little bit more detail about maybe those last 3 to 5 years that David, was able to, get those results once he was on the right road and things like that. And I know also we'll get into a little bit more detail about emotional intelligence, which I know is an area you're very passionate about, and how you move that together with case acceptance and treatment planning and that. So, but I know before we wrap, you wrote a book. I think you were showing me kind of right before that you've wrote there. That's on emotional intelligence, EO or EQ.
It's dental EQ. how improving your emotional intelligence impacts your dental practice. You can get it on Amazon. It's in Kindle too. So what I did was I just tied some things together I read, all the EQ books that I could find, and then I just tried to make dental applications.
Yeah, absolutely. Well, David, thank you so much. Really appreciate you coming on the podcast. Like I said, we're going to get into a little bit more detail on the audio podcast, but it's always nice hearing people's stories and what a great place to be in. Like you said, a great career, and now you're giving back. So thanks for your time.
Thank you so much for letting me be here. I appreciate you offering this and letting me do it. Thank you.
Absolutely. All right. Take care.